Right now, while you're listening to this, there's a habit you do every single night that might be quietly working against your heart. And the strange part is, it feels good, it feels comfortable, it feels like rest. But for millions of people over the age of 60, the position they fall asleep in could be the difference between waking up refreshed and waking up in the middle of a medical emergency. In the next few minutes, I'm going to show you exactly which positions put your brain and heart at risk, and the two that could quietly protect you starting tonight. So before you settle in tonight, I need you to hear this. If you tend to roll onto your right side the moment your head hits the pillow, I want you to pay very close attention, because that one habit, the one that feels so natural you don't even think about it, might be putting steady pressure on the way blood returns to your heart, hour after hour, night after night. And here's the part that genuinely concerns me as a physician. A surprisingly large share of strokes don't strike during the stress of the workday or in the middle of some intense activity. They strike in the quiet early morning hours, when you're deepest asleep and least able to react. My name is Dr. Alex Mitchell, and over the next several minutes, I'm going to walk you through 5 sleeping habits, ranked from mildly concerning all the way to the one I beg my older patients to stop tonight. But I'm not going to leave you with a list of problems. I'm going to give you 2 specific sleeping positions that can genuinely improve how your body circulates blood and oxygen while you rest. Stick with me, because the last habit on this list is one that nearly everyone does, and almost nobody connects it to what's happening in their arteries at 2 in the morning. Here's what I'd love you to do before we go any further. In the comments below, tell me one word. Are you a back sleeper, a side sleeper, or a stomach sleeper? Type it in right now. Because in just a moment, I'm going to tell you whether your favorite position made this list. And if you're past 60, or you're managing blood pressure, or you simply want to protect your brain for the decades ahead, what I'm about to share isn't just interesting. It's something you'll want to act on. Let's begin with number 5. Number 5 is sleeping completely flat on your back with no elevation whatsoever. Now, I understand the appeal. It feels balanced. Your spine lies in a straight line. A lot of people grew up being told this is the correct way to sleep. But let me explain what's actually happening inside your body when you lie perfectly horizontal for 7 or 8 hours, especially once you're past 60. When you're flat, gravity stops gently helping blood drain away from your head. Instead, fluid and blood volume tend to settle more around your upper body and skull. In a younger person, this is no problem at all. Young blood vessels are flexible, elastic, forgiving. They expand and contract without complaint. But as the decades pass, those vessels stiffen. The delicate arteries inside your brain become more fragile and less able to handle sustained pressure. Have you ever woken up around 3 or 4 in the morning with a dull, heavy ache behind your eyes or across your forehead? Most people brush it off. They assume it's a bad pillow or a rough night. But sometimes, that early morning pressure is your body telling you that fluid isn't draining the way it should while you sleep flat. Research published in sleep medicine literature has looked closely at head elevation during rest, and the findings are striking. Even a modest tilt of the upper body, just 15 degrees, can meaningfully ease pressure inside the skull and help blood circulate back toward the heart more efficiently. Here's the mistake I see constantly. Someone wakes up, sits up too quickly, feels the room spin for a few seconds, and thinks, well, I'm just getting older. No, that lightheadedness is a clue that your circulation while sleeping isn't working as smoothly as it should. The fix is simple, and I promise I'll give you the exact setup before we're done. But first, you need to hear number 4, because this one surprises almost everyone I tell. Number 4 is sleeping on your right side, particularly if you have any history of heart trouble or elevated blood pressure. Now, this might sound oddly specific, so let me explain the anatomy, because once you understand it, it makes perfect sense. Your heart doesn't sit dead center in your chest. It leans slightly to the left. There's also a very large vein running up the right side of your body called the inferior vena cava, and its entire job is to carry blood from your lower body back up to your heart. When you lie on your right side, your body weight and your internal organs can press gently against that vein, making it just a little harder for blood to flow back where it needs to go. For a healthy person in their 30s, the heart shrugs this off. But picture someone in their 70s whose heart is already working a little harder than it used to, whose arteries are already a touch narrowed. Now add 7 hours of extra effort, night after night, year after year. Here's something many cardiologists have quietly observed. People with weakened heart function often instinctively avoid sleeping on their right side. It just doesn't feel right to them, and they shift away from it without knowing why. That instinct is worth listening to. Studies examining sleep position in heart patients have generally found that left side sleeping is associated with steadier circulation and less strain on the heart overnight. Think about the person who's managed their blood pressure faithfully for years, taking their medication, doing everything right, but sleeping on their right side every single night. There's no dramatic symptom, nothing alarming during the day, but quietly, their heart is compensating in the dark, working a little harder than it should. That kind of slow, invisible strain doesn't show up at a routine checkup, And if you typed right side sleeper earlier, don't go anywhere, because number 3 may apply to you as well. Number 3 is stacking 2, 3, even 4 pillows beneath your head. People do this for all kinds of understandable reasons. To breathe easier, to calm acid reflux, to clear their sinuses. And yes, a little elevation genuinely helps. But here's what too much elevation does that almost nobody talks about. When your head gets propped up high, your neck bends sharply forward. Not gently, but dramatically, sometimes pressing your chin halfway toward your chest. And running up both sides of your neck are the vertebral arteries, blood vessels that feed the deepest, most essential parts of your brain. The areas responsible for your balance, your coordination, even your consciousness itself. When your neck is folded forward for hours on end, those arteries can become partially pinched. You won't feel anything in the moment, but over months and years, chronically reduced flow to those vital regions adds up. Ever wake up with a stiff neck and a dull throb right at the base of your skull? Most people chalk it up to tension or simply getting older. But that ache can be a sign of restricted circulation through those very arteries. Research into how neck position affects vertebral artery blood flow has shown that extreme forward bending measurably reduces it. And while those studies weren't about sleep specifically, the principle holds. If your neck spends 8 hours a night folded into an awkward angle, the cumulative effect matters. I've seen this pattern again and again. Someone wakes up every morning with neck pain and a headache, convinced it's just stress. Then they switch to a single, properly contoured pillow, and within a week, the symptoms melt away. One pillow. That's all it took. But we're only at number 3, and number 2 is where things start to get serious. Number 2 is sleeping curled up tightly in the fetal position. This one is incredibly common, especially among older adults. It feels safe, it feels cozy and protective. But from a physical standpoint, this position creates 2 real problems. First, your lungs simply cannot fully expand. When you tuck your knees up toward your chest and curl your chin down, your rib cage compresses inward. Every single breath you take through the night becomes shallower than it should be. You know that feeling of waking up and struggling to take one good deep breath, like your chest is tight and stubborn? That's often because your lungs spent hours working in a cramped, restricted space. And when your oxygen intake drops even modestly through the night, the oxygen level in your blood dips along with it. For someone with cardiovascular concerns or the early stages of lung trouble, that reduced oxygen puts quiet stress on both the heart and the brain. The second problem is tension. In a tight curl, the muscles of your neck and upper back stay contracted for hours, and the small vessels around the base of your skull can get squeezed, trimming the flow of blood to your brain just a little. Research in respiratory physiology has shown that postures involving significant spinal flexion reduce the volume of air you take in per breath. Over a full night, that's hundreds of shallow breaths adding up. So someone wakes up groggy, foggy, maybe with a faint headache, and assumes they just slept badly. In reality, their brain may have been running on slightly less oxygen for hours. The adjustment isn't complicated, and I'll show you exactly how at the end. But first, we have to talk about number 1, because this habit stacks several risks into one single nightly routine. And if you do it, I want you to stop tonight. Number 1 is going to bed within 2 hours of a large meal, or worse, after drinking alcohol in the evening. Now, I know this one lands close to home for a lot of people. A nice dinner, a glass of wine to unwind, then off to bed. It feels like one of life's simple pleasures. But from a circulatory standpoint, this is the single most dangerous combination on this entire list. Here's what unfolds. When you eat a big meal, your body sends a surge of blood to your digestive system to handle the work. That's completely normal. But it also means less blood is freely available for your brain and other organs at that moment. A younger body compensates effortlessly. But in an older adult whose arteries are already narrowed, that redistribution can trigger dizziness, lightheadedness, even fainting during sleep. Now layer alcohol on top. Alcohol widens your blood vessels and causes your blood pressure to drop. For someone with healthy, flexible arteries, that just feels pleasantly relaxing. But for a senior with plaque buildup or stiffened vessels, that sudden drop can set off a chain reaction. The body senses the dip and overcorrects, pushing pressure back up. Then it falls again. Those wild swings strain vessel walls that are already fragile. And in places where flow becomes turbulent and erratic, the conditions for trouble can develop. And all of this is happening while you're completely unconscious, unable to notice or respond. Studies on alcohol and nighttime blood pressure have found that even a moderate amount close to bedtime can disrupt the natural dip in blood pressure that's supposed to happen during sleep. When that healthy nighttime dip doesn't occur, the strain on your cardiovascular system climbs. Picture it. Someone finishes dinner at 8, enjoys a couple glasses of wine, and turns in around 10. Then at 2 in the morning, they jolt awake with a pounding heart, a thumping headache, maybe a film of sweat. They tell themselves it was just a bad dream and roll over. but that may have been their body scrambling to stabilize a circulatory system thrown out of balance. And over the years, those small episodes accumulate quietly, leaving tiny bits of damage you never even notice, until one night it isn't tiny anymore. So if you take nothing else from this entire video, take this. Finish your dinner at least 3 hours before bed. If you drink, stop 4 to 5 hours before you sleep. And after dinner, take a gentle 15-minute walk. Just light movement. That one habit alone can do more to lower your overnight risk than people realize. Now, those are the 5 to avoid, so let's talk about what you should actually be doing instead. The first protective position is sleeping on your left side. And let me share something that even some doctors overlook. Because your heart sits slightly left of center, sleeping on your left side lets gravity gently assist the flow of blood rather than fight against it. Your heart works a bit less, circulation runs smoother, and your brain receives a steadier supply of oxygen through the night. That's the basic cardiology, and it's reason enough on its own. But here's the part that genuinely changes how you should think about sleep. About a decade ago, researchers identified something called the glymphatic system. Think of it as your brain's overnight cleaning crew. While you sleep, this system flushes out the metabolic waste and proteins that build up throughout the day, including the very proteins linked to Alzheimer's disease. And here's the fascinating finding from neuroscience research. This cleaning system appears to work most efficiently when you sleep on your side, with side sleeping showing real advantages for clearance. Let me put it plainly. Every single day, your brain accumulates waste proteins. In a healthy brain, the glymphatic system clears them out each night. But if you're sleeping in a position that hampers that cleanup, those proteins can slowly accumulate. Not in a night, not in a month, but over years and decades. And by the time symptoms appear, much of the damage is already done. Sleeping on your left side helps that nightly cleanup do its job. So this isn't only about protecting yourself from a stroke tonight. It's about protecting your memory and your mind 20 years from now. There's a bonus too. If you struggle with acid reflux, left side sleeping uses the natural shape of your stomach to keep acid down, so you wake without that burning in your chest. Now, if you've slept on your right side or your back for 30 years, I know switching feels impossible. So here's the practical trick. Get a long body pillow and hug it in front of you. It anchors you on your left side, supports your spine, and if your hips or knees ache, tuck a small pillow between your knees for relief. And the question I always get, but Dr. Mitchell, what if I roll over in my sleep? You will. Everyone does. The goal isn't perfection. The goal is simply to spend more of the night in a helpful position than a harmful one. But there's a second position that works beautifully for certain people, and you'll want to hear who it's right for. The second protective position is back sleeping with gentle elevation. Not lying flat and not sitting bolt upright, but a smooth, gradual incline that raises your entire upper body somewhere between 15 and 30 degrees. You can achieve this with a wedge pillow, an adjustable bed, or carefully arranged pillows. The key detail is that your whole upper body rises together, not just your head bent forward at the neck. Why does this help? 3 reasons. First, blood returns to your heart more easily from your lower body, which is a real gift if you deal with poor circulation, swollen ankles, or varicose veins. Second, the pressure inside your skull eases, which matters enormously for anyone with fragile brain vessels or blood pressure that isn't fully under control. Those tiny vessel ruptures that quietly accumulate over the years, contributing to memory loss and a kind of decline doctors call vascular dementia, become less likely. Third, your breathing improves because your airway stays more open, easing snoring and congestion and getting more oxygen to your brain. Here's a detail almost everyone misses. If you elevate your upper body, slip a small pillow beneath your knees as well. This keeps the natural curve of your spine intact and takes the strain off your lower back. Together, this creates what's known as a zero-gravity posture, the same body position NASA studied for astronauts, because it spreads pressure evenly and reduces stress on joints and vessels. But let me be honest with you, because this position isn't for everyone. If you have significant sleep apnea, even an elevated back position may let your airway collapse. And in that case, the left side serves you far better. The point isn't to follow a rule blindly. The point is to understand why each position works, so you can choose what fits your own body and your own health. Have you tried either of these? Drop a comment and tell me whether you're a left side sleeper or an elevated back sleeper. I genuinely want to know what's worked for you. Now let's talk about your bedroom itself, because even a perfect sleeping position won't help if a few key things in your environment are working against you. Your bedroom isn't just a place to sleep. It's the environment where your heart and brain either recover or quietly wear down. Start with temperature. Keep your room somewhere between 64 and 68 degrees. A cool room helps your core body temperature drop, which is the signal your body uses to slip into deep sleep. and it gently lowers your nighttime blood pressure too. If your room runs too warm, your body has to work to cool itself. You linger in lighter sleep, and your heart rate stays elevated, robbing you of the deep, restorative phases where real healing happens. Next, cut out blue light in the last hour or two before bed. Phones, tablets, televisions, harsh overhead lighting, they all suppress melatonin and delay the deep sleep stages when your brain does its cleaning and your circulation settles. If you must use a device, switch on night mode or wear blue light blocking glasses. Better still, read a few pages of an actual book to let your mind wind down. Then there's neck support, which we touched on earlier. A memory foam pillow contoured to cradle the natural curve of your neck can all by itself protect the flow through those vertebral arteries we discussed. And finally, sound. Even noises that don't fully wake you can jolt you out of deep sleep, spiking your heart rate and nudging your stress hormones upward. You won't remember these little disturbances, but your vascular system registers every one. A simple white noise machine or a pair of earplugs can smooth out those jarring interruptions. None of these are mere suggestions. They're factors that quietly shape your overnight risk. And if you want to take this a step further, you can actually start listening to what your body is telling you while you sleep. A small overnight pulse oximeter that clips onto your finger can track your oxygen levels through the night. And if your oxygen repeatedly dips too low, that's valuable information to bring to your doctor. A smartwatch or sleep ring can measure your heart rate variability, a quiet indicator of how well your nervous system is recovering. And the simplest tool of all is a sleep journal. Each morning, jot down how you feel. Headaches, dizziness, numbness, brain fog. Over time, patterns emerge that no single office visit could ever catch. But let me be very clear here. These tools are for awareness, not diagnosis. They don't replace a real medical evaluation. If you notice troubling patterns, if symptoms persist, if you carry stroke risk factors, please bring it to a qualified healthcare provider. Self-monitoring is empowering, but it isn't a substitute for professional care. What these tools give you is something precious though: data, awareness, the end of guessing. So let me tell you why you've probably never heard most of this from your own doctor. It's not that they don't care. It's that sleep position simply doesn't fit into a standard appointment. There's no blood test for it, no scan, no prescription to write. In a brief visit, your physician is checking your labs, adjusting medications, addressing whatever urgent symptom brought you in. How you arrange your body at night just isn't on the checklist. But the research keeps pointing in the same direction. The way you sleep can quietly influence your circulation, your oxygen levels, the pressure inside your skull, and your brain's ability to clear away toxic waste. These aren't sudden, dramatic events. They're slow, cumulative processes, building night after night, year after year. And for anyone over 60, or anyone managing their blood pressure or their heart, those nighttime habits become genuinely important. Here's the empowering truth that most health advice skips right over. You don't need a prescription for any of this. You don't need an expensive treatment. You need awareness and one or two small, deliberate changes. Shift to your left side. Raise your upper body 15 degrees. Stop eating 3 hours before bed. Trade 3 pillows for 1 good one. Any single one of those changes can measurably improve how your body functions while you rest. And you're not just lowering your stroke risk tonight. You're investing in a sharper mind and a stronger heart for the next 20 or 30 years. By simply taking the time to watch this and understand these connections, you already know more about protecting your brain at night than the vast majority of people ever will. So here's exactly what I want you to do today. Pick just one change from everything we covered. Maybe it's sleeping on your left side. Maybe it's finishing dinner 3 hours before bed. Maybe it's switching to a single contoured pillow tonight. Choose one and commit to it for 7 days. Then pay attention. Notice whether your morning headaches fade, whether your energy lifts, whether your mind feels a little clearer. Your body will tell you the truth. And then come back and drop a comment below telling me which habit you changed first. Because your answer might be the very thing that helps someone else recognize a pattern they'd never considered. If this gave you something you'd never heard before, give it a like and pass it along to someone who needs it. Someone over 60, someone watching their blood pressure, someone who keeps waking up with symptoms they can't explain. And here's why I want you to subscribe right now. In my next video, I'm breaking down a handful of specific, everyday foods that research suggests can meaningfully lower stroke risk, and not in some vague general way. I mean the specific foods and how to actually use them. Here's the twist. You almost certainly have several of them sitting in your kitchen right now, but you're probably preparing them in a way that strips away their benefit. This is the kind of practical, research-backed information that rarely comes up in a standard doctor's visit, but it could genuinely shift the direction of your health. So hit subscribe, turn on your notifications, and I'll see you there. Until then, sleep smart, stay informed, and protect your brain. I'm Dr. Alex Mitchell.